Well, Democrats eagerly awaiting the CBO score, the sort of price tag of their bill, many still uncommitted on exactly how they'll vote until this number comes out.
But one former CBO director warns whatever the report says, it'll still be incomplete. To former CBO director Doug Holtz-Eakin on just what we can believe when the numbers come out. Why do you say, Doug, that it's incomplete even when the numbers come out?
Well, you can see the process that's going on right now. As Rich Edson mentioned, they're still finalizing the bill. So CBO will not have the final bill until the very last minute. They'll be unable to really dot the I's, cross the T's, and they'll be guessing at some of the provisions.
All right. Well, the big question is, I mean, the main selling point of this bill is that it's actually going to save money over the long term. That's what the president says, not adding a dime to the deficit, but it is a new entitlement covering 30 million people. Has a new entitlement ever saved money?
No, and this bill is not going to save money over the long term. There has yet to be any nonpartisan, dispassionate analyst that says this bill changes the growth of costs of health care spending in the United States. Indeed, Richard Foster, the administration's own actuary, said that it would raise national health care spending. So the bill is going the wrong way on the most important problem. And then from the federal budgetary perspective, the bill sets up two brand new entitlement spending programs. They grow at 8% a year as far as the eye can see. There is no way that is good news.
Okay, let's get to what you just said about it raising spending, overall national health care spending. Well, if we're adding millions and millions of people to the rolls, of course we see that short term. The Democrats would argue that eventually down the road this would actually bend the cost curve. Why doesn't that work from where you sit?
They really haven't put enough in the bill that would fundamentally do that. For example, real health care reform would change the way we pay in Medicare to focus on outcomes and not pay doctors for doing more. They don't undertake any structural changes of that type. Instead, they rely on two big gimmicks. Number one, a prayer that future Congresses will continue to cut Medicare year after year. It's never happened. It's not going to happen in this case. And number two, they put in place a commission that is supposed to provide recommendations to Congress that they must undertake to cut Medicare spending. But the reality is we already have a Medicare Payment Advisory Commission. I served on it. Congress ignores it when it delivers bad news, and Congress will ignore the future commission as well.
Well, there's another gimmick that you didn't mention, using 10 years of taxes to pay for 6 years of spending. I mean, I don't know
David,
many people willing to defend that.
I have watched Congresses for a long, long time, and every budget gimmick that was ever dreamed up is included in these bills. They have left no stone unturned. Indeed, if you look at the first full 10 years of total spending in this bill, it's about $2.5 trillion. There's nowhere close to $2.5 trillion worth of financing for this. They only make it add up by picking the right budget window, backloading the spending, front-loading the revenues, double-counting Medicare trust funds, things like that. This is not an exercise in solid budgetary practice. This is not a good exercise in health care reform.
Doug, what
These
about
are dangerous bills.
But what about the argument, Doug, that if you just let this continue the way it's going, then it will end up totally cracking and breaking the system? We've got Medicare, of course, which is government health care. Let's call that what it is. And clearly that is extraordinarily costly. And then you look at adding all of the people to the rolls. But how can we do this in a proper way? I mean, you sat in the CBO seat. What's the best way to do it?
The best way, quite frankly, is to go back to the drawing board and do a bipartisan bill. The bipartisan bill would have two big advantages. Number one, it would focus on cost control and not just coverage expansions. Number two, it would be a durable reform, one that both sides had signed on to, and we might actually get the kinds of improvements we need. No one is arguing that the current system is a good system, and no one should be arguing that we're just fine where we are. But to pass these bills and then, as a result, to take Medicare reform off the table, because they will have made huge changes to Medicare. There's no way a future Congress is going to go back to it and say, oh, yeah, we're ready for Medicare reform now. They're tired. They won't touch it for another 5 years, and we'll be in worse shape.
Doug Holtz-Eakin, good to see you.